All right, so today we're not just going to look at some medical scans. No, we're going to become detectives. You've probably heard the human brain called the ultimate black box, right? Well, neuroradiology is what gives us the key. It lets us peek inside. We're going to crack open a case file and see exactly how these incredible pictures solve actual life or death mysteries. Let's get right into it.
And that's really the big question, isn't it? When something goes wrong inside your skull, how on earth do doctors see what's happening? I mean, they can't just, open it up and take a look. They need a way to see through bone, through tissue, and critically, they need to do it super fast. And that brings us right here to the Brain Detectives Toolkit. These are the amazing imaging technologies that let doctors hunt for clues inside our heads, basically turning a scary medical crisis into a puzzle that they can actually solve. Okay, so the two main tools in the kit are the CT scan and the MRI. Now, look at this chart, because this is what's really fascinating. Check out the radiation dose. A standard skull X-ray is tiny, right? About 0.07 millisieverts. But a CT head scan? Whoa, that's 2 millisieverts. It's a way more powerful tool, and it gives a much better picture. But that power comes with a trade-off, a much higher dose of radiation for the patient.
So, how do you choose which tool to use? Well, it all comes down to what you're hunting for. A CT scan, that's the workhorse of the ER. It is blazing fast, and it's brilliant for spotting fresh blood or fracture in the skull. An MRI, on the other hand, that's the master of detail. It doesn't use any radiation, and it gives you this unbelievably clear view of the brain's soft tissues. You know, the gray matter where the brain cells live, and the white matter, which is all the wiring connecting everything. Picking the right tool is the first and maybe most critical step in the whole investigation.
Let's put this into action. Let's open up our first case file, head trauma. So, imagine this. A patient is rushed into the hospital after a car crash. They're unconscious. The clock is ticking, loud. The very first thing you do is get them into a CT scanner to find out what is going on inside that black box.
The scan comes back, and it shows a bleed. Okay, but here's where the real detective work begins, because not all bleeds are the same. On the left, you've got an extradural hematoma, or EDH. That's usually from a torn artery after a big impact. And notice this, it's held in a tight little pocket by the skull's seams, what they call sutures. Now on the right, you have a subdural hematoma, an SDH. That's often from a torn vein, sometimes after something as simple as a fall, and it's not held back by those sutures, so it spreads out. Figuring out which one it is tells the surgeon exactly where they need to go and what they need to do.
Now, telling these two shapes apart on a scan can be a little tricky, but the source material for this explainer gives us a really great way to visualize the difference.
An extradural hematoma, think of it like a blister that's forming under some really tightly glued wallpaper. The seams in the wallpaper, those are like the skull's sutures. They won't let it spread out, so it just bulges inward, making this classic, tight lens shape. A subdural hematoma, though, that's like spilling water under a rug. There are no seams to hold it back, so the water just spreads out wherever it can go, creating this long crescent shape that hugs the curve of the brain. It's a perfect analogy, and it really shows you the key clue they're looking for. But what if your patient is in a coma, and the CT scan looks completely normal? This is a really scary puzzle called a diffuse axonal injury, or DAI. See, axons are the super delicate fibers that connect our brain cells, and in a DAI, they get sheared and damaged on a microscopic level. It's just too small for a CT to see. And this is when you call in the MRI. It's the only thing sensitive enough to see the tiny shifts in water in the brain tissue that signal this widespread, absolutely devastating damage.
Okay, let's switch gears to our next case. And for this one, the biggest enemy isn't the injury itself, it's the clock. We're talking about a stroke emergency.
4.5 hours. For the most common kind of stroke, the one caused by a clot, that is the golden window. If doctors can get a powerful clot-busting drug into the patient within that time frame, they might be able to completely reverse the damage. But they have to be 100% sure of what they're treating.
So this is the protocol, the game plan. The patient arrives, and they are rushed immediately to get a CT scan. The entire reason for that scan is Step 3, to rule out a hemorrhage, which is a bleed in the brain. Only if there is no bleed can they move to Step 4 and give that life-saving drug.
And this right here is why that CT is so absolutely critical. See, a stroke can be caused by a clot or by a bleed, but the symptoms? They can look identical. Giving a clot-busting drug to someone who has a brain bleed would be a catastrophe, just unthinkable. So the CT scan is the gatekeeper. It's the one picture that gives the green light go or the red light no go on the treatment that could save that person's brain.
All right, let's look at one more scenario, a totally different kind of case.
Because imaging isn't just for emergencies. Sometimes it's about solving a long-term, really complex mystery, a true diagnostic puzzle.
So, let's say you have a patient with really confusing neurological symptoms. The big question might be, is this multiple sclerosis, or is it a similar-looking condition called neuromyelitis optica? The treatments are completely different, so you have to get it right. The radiologist uses an MRI to hunt for clues. For MS, they're looking for things like inflammation in just one optic nerve and short little patches of damage in the spinal cord. But for NMO, the clues are different. Inflammation in both optic nerves and much longer stretches of damage in the spine. The picture literally tells the story and points the doctors in the right direction.
So, from the absolute high-stakes drama of the ER to the careful, quiet detective work of a chronic disease, we've seen it again and again, the incredible power of a picture. Being able to truly see inside the brain, it just changes everything.
So let's just quickly recap the big takeaways. First, in trauma, imaging tells surgeons exactly where to go. Second, in a stroke, that saying time is brain is literally true, and imaging is the key to using that time well. Third, for confusing diseases, these pictures can finally provide the clarity you need for a diagnosis. And running through all of it is that crucial choice, the speed of a CT versus the incredible detail of an MRI.
And that kind of leaves us with one last thought to ponder. I mean, we've gone from blurry X-rays to seeing the actual fine-grained wiring of the brain. So as our tools get even more powerful and our pictures get even clearer, what secrets of the black box do you think we'll solve next? From things like consciousness itself to the diseases that threaten it, what will we finally be able to unlock?